Total number of life-saving surgeries done here. All of them are life-saving surgeries. How many have been done?
246 life-saving heart surgeries have been conducted, since we started our journey of doing surgeries for the children with heart defects.
And these are children from all different parts of Fiji and the Pacific?
Yes, Vijay, we have children coming from Viti Levu, Vanuatu, from the maritime region. We have children who have come from Vanuatu, Kiribati, Solomon Islands, Christmas Islands, Tuvalu, Papua New Guinea. So from all over the Pacific, which is such a game changer, because so many of these children would eventually die. That is the reality, Vijay.
Funding will no doubt be an issue and will be going into any medical facility, and your medical facility, state of the art. You definitely need funding, first of all, to set it up, but then you need the cost to continue to run it. The journey so far, you said 18 months, and even starting off to ensure you have a facility like that, how much did it cost in terms of value and time to ensure that you achieve this, and where were you sourcing funding from, because it's always hard?
That's a real challenge, and it's never easy, especially if you're a facility that has no billing counter. You're not going to generate any revenue, yet cost of healthcare is high. And children's heart surgeries, or any heart surgeries, probably the most expensive surgeries anywhere in the world. So it was not easy, even with building of the hospital. We discussed earlier, it cost $25 million. The government had granted the land, but we as an organization had to talk to so many people from around the world who felt for the cause and who helped us. It wasn't easy. My husband Sumit went to many parts of the world, performing and talking to people. We have a small group of our trustees and a core team. Everybody worked incredibly hard to talk to people all around the world, and people in Fiji as well. And that's how we were able to build the facility. Of course, the building is one part, as you mentioned. Then the surgeries, there's a cost associated with the surgeries, cost of medications, consumables, bringing the teams in, their airfares, their accommodation, meals, transport. Believe me, it's a big cost. And so far, the way we funded these really has been through individuals from around the world who've been donating. Many of our members have given all that they have in terms of savings. It has been challenging. We've had some smaller corporates here who have helped us with grocery needs for the parents and the children, donating vegetables and fruits and those sort of things. But really, a lot of it has been money that we've had to raise and pay for a lot of things. So it's not been easy. It's been quite challenging. But I do have to say that thanks to the new coalition government, they have realized the value that this hospital adds, and have put us in the budget for the new budget this year. So that's a welcome relief, because till now, we as a foundation and a hospital have had to work really hard to ensure that the hospital runs.
It's great news for parents and children, as I said, that we have a facility now. Otherwise, on the minimum cost, it's about $100,000 to fix a heart defect. The total number of surgeries, you said, more than 200, and you continue to look at doing more surgeries. How many remain for this year?
So this year we will have another team that will come. They'll be coming from Europe, UK. It's a mixed team. The surgeon is from Czech Republic, in Prague. We have a few of the cardiologists coming from Prague as well. A couple of doctors, nurses coming from Great Ormond Street Hospital in London. Some nurses will come from Australia as well. So a mixed team, but predominantly a UK-based team. That will be in November, and probably another 20 to 25 surgeries will be conducted. We're working on our list, prioritizing which children really need the surgery right now. And of course, many children from Fiji, and there will be children from the Pacific Islands as well. We get referrals from the Pacific as well, so we work on prioritizing.